So let's talk about the pre-op visit. I mentioned after you get your trigger, you're usually going to come in the following day for a blood draw, and we can make sure your trigger is working. And that day, we often will have you meet with one of the doctors to do your pre-operative visit in person. That gives us a chance to check your blood pressure, listen to your heart and lungs, and clear you for surgery. And at the visit, you'll also sign consent forms. We typically are going to go through a lot of instructions on that visit, and you're going to get a repeat of those instructions before you go home from your retrieval the next day. But let me give you my typical spiel. First of all, when you're going through a retrieval, you're going to know exactly what day and time to come in. Usually a retrieval will be scheduled in the morning. You'll be instructed to come in 30 minutes before, and you're going to be instructed to come in hungry and thirsty. That means nothing to eat or drink after midnight the night before your procedure, not even sips of water. The only exception to that is if you take blood pressure medication, we do want you to take that before your procedure. But otherwise, you should come in hungry and thirsty, and we promise not to talk too much about food. When you get to the office, our nurse is going to bring you back to the post-op area to get you checked in, and they're going to put a little IV in your vein to get you fluids through that IV, get you rehydrated. You'll then meet with our nurse anesthetist who's going to go through your medical history, and you're going to fill out a form in that pre-op visit that fills in all your possible medical history. And if you've had reactions to anesthesia in the past, this is where you're going to write that down for us. Our nurse anesthetist is going to go through that information and ask any follow-up questions that she may need to make sure we get the right doses for you to be comfortable. We use 2 to 3 main medications when you go through egg retrieval that allow you to be completely asleep and comfortable during that procedure. And from the post-op area, we're going to walk you to the procedure room. All of it happens in our main building where you've seen us for your testing thus far. We're going to walk you to the procedure room and lay you down on an exam room table, give you medications through the IV. You're going to take the best nap of your damn life. And after you're asleep, we're going to put your feet up into stirrups. So you may not even remember being in that GYN position. The anesthesia is pretty strong, and we do that on purpose to keep you comfortable. But when you wake up, we're going to make sure you're comfortable. We do not want you to drive yourself home. Somebody else needs to give you a ride home. We don't want you to drive for 24 hours after the anesthesia. By the following day, most women are feeling fine. Honestly, the same day, most women are feeling fine. You're going to go home that morning. You're going to be walking around. You're going to be eating. You're going to be peeing. You're going to be pooping. You're going to kind of feel maybe a little loopy and your head's in the clouds, but you might not notice it. And so for that reason, no driving. I also tell patients no important decision making that day, no unsupervised online shopping, no unsupervised online gambling. You sit, you relax, you watch some Netflix. If you've got another kid running around the house, you try to avoid running around after them and picking them up, but you'll be on your feet and moving around. We just don't want you to have to do anything too important. When you're asleep and your legs are up in stirrups, we usually use a brown betadine soap to sterilize the skin on the bottom and inside the vagina. And that allows us to help prevent any risk of infection. We're going to use the same transvaginal ultrasound probe that we've been using to monitor your ovaries throughout the process. But this time the probe has a little needle guide that goes along the top and a long skinny needle that fits through that guide. The needle is just going to pop right through the top of the vagina and into your ovaries on each side. And since it's an ultrasound, we can see where our needle is the whole time. We go into each of those follicles and we aspirate the fluid out. And ideally, we're getting little mature eggs out with that fluid. So we're handing the fluid off to the embryologist who's at your bedside throughout the procedure. And they're clearing off the eggs and counting them in real time. That means that you're going to wake up with tiny little puncture holes at the top of the vagina. Usually there's not any stitches, there's not any big incisions. You'll never really know where those puncture holes were. And typically we're taking a look at those puncture sites before you ever wake up from anesthesia to make sure that they're dry and not actively bleeding. When you go home, a little bit of light vaginal bleeding would be very normal, like a light period or lighter. And it should get lighter as the first 2 to 3, 4 days after retrieval go by. You should know, though, that most women are going to get a period anywhere from 5 to 14 days after the retrieval. So you'll go home and see a little light bleeding, then it goes away, then it picks back up. That's just your period coming. That's very normal. You didn't break anything inside there. But until that period comes, we want you to continue some of the restrictions that we recommend during this process. So that means when you go home, showers are okay, but no bathtubs, no hot tubs, no swimming pools, no submerging above your waist. The last thing I want is like dirty pool water up inside the vagina infecting those puncture sites where the vagina is trying to heal. Additionally, no tampons and no sex, nothing inside the vagina until your period comes after this retrieval. So if you're having light bleeding, just liners or pads. We also want you to keep the physical activity to a minimum until your period comes. A lot of people are exercising as part of their kind of fertility journey, trying to live your best life, and we definitely encourage that. But as you're recovering from this process, you're going to have big old ovaries, and when they get smaller as your period is approaching, they become a little bit shifty and a little bit out of balance. And too much aggressive physical activity, even getting your heart rate up by doing some incline walking, can potentially put you at risk for one of those ovaries twisting on itself. And that's something that we call ovarian torsion. Ovarian torsion is a surgical emergency. Your partner's calling us in the middle of the night because you can't stand up straight and you're in excruciating pain and you can't dial the phone yourself. They're taking you to an ER, and we're making phone calls to let them know this person just had an egg retrieval. Sounds like a torsion. She might need emergency surgery. And when you have a torsion, you got to go in and you got to untwist that ovary to try to save the tissue, and the blood supply gets cut off otherwise. So please be taking it easy until your period comes. And that's how you know your ovaries are pretty well shrunk back down to normal. So that means in general, call for heavy bleeding, call for pain that's getting worse and not better. And in terms of pain control, we recommend, if you're able, to take ibuprofen, and you can take 600 to 800 milligrams as you're recovering. But we don't want you to take any ibuprofen before the retrieval. It's for only after the retrieval has happened for post-operative pain. If you're having aches or pains before your retrieval, please let us know and we can talk about what things may be helpful and safe at that time. But in the recovery time period, ibuprofen is your friend. You don't need to be a hero. We don't care if you take it or don't take it. So just take it, and that way you're comfortable. I would rather you take ibuprofen and be walking around comfortably because you're going to recover faster than not be taking it because you're trying to be a hero, but you're stuck in bed or on a couch because it hurts too much to get up and move. So take it. It's your friend. It's not harmful. If your pain is getting out of control and ibuprofen is not keeping it under control, I want you to notify the office. The other risk is, I mentioned that betadine soap that we use inside the vagina to help sterilize things. When you go home from your retrieval, you'll be given instructions for taking an antibiotic for several days after the retrieval to help make sure that there aren't any bacteria that come from the vagina and decide they want to seed and implant and grow in your ovaries or in your body otherwise. So you'll get instructions and a reminder to start taking that with dinner after your retrieval. You don't need to worry about it prior to the procedure. Call if you have a fever, call if you have chills. This is a really low risk procedure for infections. And in fact, you're more likely to get an infection from COVID-19 than you are to get an infection from this procedure. But also call us if you got COVID-19 because we'd like to know that as well for our records, okay? Otherwise, as you're waiting for your period to come, things are happening in the embryology lab that we've already mentioned. Typically, it takes 1 week for us to see how many embryos we have frozen on your behalf. And if you opt to do the PGT-A testing, it's another 2 weeks after that you're awaiting those results. And in the meantime, as your period comes, your body is recovering and you're clearing out all of these high hormone levels.